Many of those who are listening are working professionals in patient experience roles. And what advice would you have them? How would you explain, or how might they explain to a healthcare CEO in a minute why human experience matters strategically? How would we explain that in your view?
Well, as a CEO, do you think your workforce matters? Yeah. If you, as a CEO, do you believe the outcomes that you generate for your patients matter? Do you believe that the way that your community perceives you matters? And are your business outcomes important to you? If those four things matter to you as a CEO, then a focus on experience enables you to drive all of those things. And it ensures that you drive quality outcomes, that you care for a workforce, and you create a healthy, vibrant culture, which you as a leader are responsible for, that you ultimately care for a community and you have that reputation to be the place that people choose, and that you drive the business results that we know your board holds you accountable to every day to ensure a vibrant and healthy healthcare institution that can deliver on its care promise. And commitment and focus on experience will deliver that for you.
Wow. And so if we think about all that's going on in healthcare right now, cost pressures, new technology, staffing shortages, things of that nature, how is this resonating? And as you think about over the last 10 years, is this getting more traction with CEOs now than it did before? Or are there so many other things going on that we are now struggling to compete with new things to get on the agenda, if you will?
It's interesting because I do think healthcare is so dynamic. I mean, if we don't use, let me just say AI now. So we said it.
Yeah,
Right?
exactly.
But I mean, all of these things are part of the equation now, right? How the processes are changing, the way we get information from ambient listening to just the portals that we use to engage people. I mean, the platforms and the methodologies and the processes are dynamically changing. Healthcare still hasn't changed at its core. And you've heard me say this a lot, Chris. We are human beings caring for human beings. It might be through multiple venues. And yes, we might interact with an AI agent every now and then, but they're informed by something, right? And at the end of the day, it's still human beings caring for human beings. So I do think where we have an opportunity is to figure out how all of those things are woven in to the experience conversation. I will say, like we were talking about before, I believe that executives get their hands around and feel more comfortable with a human experience conversation than just purely a patient experience conversation for this reason. Not that they don't believe the patient is important, but they have a broader accountability. And it makes it a lot easier, if we go back 10, 15 years, when it was like, oh, you just want me to make patients happy. I think we've evolved past that, right? I think people have understood what we're speaking about is building healthy, vibrant healthcare institutions that deliver on our promises to ensure vibrant financial outcomes, to ensure safe, quality outcomes, to care for the people in our midst, whether they're patients in need or the workforce who's showing up to work every day. And so I think that connectivity has helped transform the conversation in pretty significant ways. And not everybody's there yet. Let's be clear. There are still some people that are stuck in these are our scores. This is the spreadsheet. I want you to move this lever. And I still call those people that are stuck in the day of whack-a-mole versus PS5, maybe. I don't know. Right. So
Yeah. Well, I think you made a number of good points there. The foundational notion that what isn't going to change is humans caring for humans, I think is really important. And the way I often like to think of it is, hey, the social and emotional needs of humans don't change for thousands of years, and they aren't going to change in our lifetime. So that's not going away. The way that we use technology still needs to focus on enabling those humans to connect. Mm-hmm. And I especially found Victor Montori's comments at the Beryl Elevate conference about 6 weeks ago to be really compelling. And one of the quotes I took away from that was when he said, if you think technology is going to solve all of your problems of care, you don't understand technology and you don't really understand your problems of care. Right. Because it's all about how we use technology.
Right. 100%. 100%.
So, now, you often speak about experience as a human issue, not just a patient issue. You've talked a little bit about that. I'm wondering if we could kind of expand. What about the clinician side of things, right? Yeah. You've talked about culture and workplace and well-being and so forth, but where do clinicians fit into the picture in your view?
Yeah, I mean, and I think that is really part of the importance of the evolution of thinking that we've been talking about, really, that you can't care for patients effectively unless you care for the people who care for them, right? And I think early on, if we go back to that point in the equation, people felt like we were just asking, in particular clinicians, to do all these things to make people happy, to get a satisfaction score, to generate results in that way. And it was like, well, what about me? I'm human too. I have needs. I have challenges. I need to feel cared for. And so I really do believe that when we think about this idea of experience, it's important that we speak to that idea of the broader workforce, of our clinical teams, of our providers, of the folks who show up to clean, cook, and carry trays. I mean, all of those people show up with the same human needs. And so what I've found is when we can have that kind of conversation in an organization around the fact that you matter first in order for us to be able to deliver on the care that matters, it changes the way people think about it. Because when we look at our consumer data and we look at what people want out of healthcare, they tell us first and foremost, it's not all the shiny things or all the things that make us beautiful amenities or anything like that. They want to be first and foremost, again and again, year after year, listened to and communicated to ways and they can understand, and to be treated with some level of dignity and respect. That is the same things that our workforce asks for. And when we can do that effectively from a leadership standpoint and then build cultures that deliver on that promise, we actually are ensuring that the people that exactly you're speaking to, our clinicians, our workforce, feel the level of care needed to actually deliver on our care promises. And, I think you have spoken to this a lot for many years, similar to me. I think it's why culture was at the heart of the definition in 2010. I think it did take us. I know we don't talk about the pandemic much anymore, but I do think if we look for the silver linings and lessons of what we traversed as a world together, it elevated the fact that we have to care for each other as much as the people we care for. And that is an important takeaway that I think finally resonated in ways that was meaningful for people. So I see that as a gift that we got out of some of the horror, and something that's actually enabled us to change the conversation for exactly the very people that you're asking about too, Chris.
A great way to explain it. And I wonder if it has ever occurred to you, or have you had any dealings with medical schools? And whether patient experience insights could be part of the medical school education process. I've had the opportunity over the last year to work with a medical school and better understand the selection and testing and application and residency and all of that stuff. And it's occurred to me now, it's really obviously and necessarily focused on the clinical part, and there's some part on the patient bedside manner and so forth, but not nearly what we now know about patient experience. What are your thoughts on that? Is there an opportunity there?
100%. And definitely and a focal point for me, and I think the organization and our community, is how we inject this conversation into education in general, how we educate our future docs, how we support our nurses, how we ensure that our future healthcare administrators understand this not as simply a metric, but as a strategy and a strategic imperative. So I would love to see this injected in some way into all healthcare learning, and not in different ways. What my vision, my hope, and what we're working towards is ensuring that in all of those environments, they're learning the same ideas, so that when they end up in whatever health system they might be practicing in or leading, they're speaking the same language. So when I walk in there as a new physician, all excited to go and believe in caring for people, and meet that new young COO who's responsible for it with the director of nursing for our ED, and we all learn the same principles, we're starting off at a place that's different than we could have before. So I think we have a responsibility. I so appreciate what you're doing in some of the institutions you are, Chris, but I think we have a much bigger opportunity to create a level setting and a contextual conversation across academic venues to have people come into the work with that lens. Back to the old data. Yeah, when we teach people in medical school, we teach the empathy out of them over the years, right? I don't think that's necessarily true. I think we build it, we bury it, right? And if we could create a way to at least keep pulling that sediment back, because people chose medicine, they chose nursing, they chose leading healthcare institutions for something more than just look like a good job to do. No offense to our friends that are lawyers or working on Wall Street. That's, that they went that way, but people chose healthcare because they wanted to connect to people or do something for people's lives. And the more we can do to elevate that distinction across all those educational settings and enable people to bring that into the workplace as champions, actually transforms the way organizations could operate overall. And so that's my hope. So yes, we should be doing that.
I totally agree, because now we're kind of simply trying to add that knowledge to what they've been trained in after they're already in the organization.
And the challenge, so this is such an important point, and I hope people can take this away. What happens is then it feels like experience is a thing we do. And if experience is something we ask our docs to do, or our nurses to do, or somebody else to do, then it becomes something that's easy to say, I don't have time, or I can't do it because you want me to do these other things. really what we're asking people to think about is how you show up for other people, the way you want to be, the culture, right, of an organization, but how we want to be as healthcare institution X, Y, or Z in delivering the kind of experience we want for people. So it changes the conversation from a doing, a task, and then therefore something you could say no to a way of being that you're proud to show up every day in your own existence to be able to show up and perform in that way.